Endometriosis affects 1 in 10 women of reproductive age, yet many women under 30s may not even know much about it. So this is a condition where the tissue that lines the uterus grows outside the uterus, causing a range of symptoms and problems that can affect a woman's daily life. So the most common symptom of endometriosis are very painful periods, painful intercourse and infertility. But endometriosis can also cause fatigue, diarrhea, constipation and even depression. These symptoms can be debilitating, can affect a woman's quality of life and even confidence. So what causes endometriosis? Exact cause is of course unknown, but some theories suggest it could be genetic predisposition or a problem with the immune system. Hormonal imbalance may also play a role. If you suspect that you may have endometriosis, it's important to see a specialist who can take care of it. So they will conduct a pelvic examination and may also perform other imaging tests like ultrasound or laparoscopy to confirm the diagnosis. There are several treatment options for you that are available for endometriosis, including surgery, hormonal therapy. However, many women also turn to our natural treatments to manage their symptoms. These include diet, acupuncture, yoga and exercise, and even stress management. So it's important to note that natural treatments may be beneficial for some women with endometriosis, but may not work for everyone. It's always best to work with your specialist so that you can start the treatment there and determine the best treatment plan for you. Endometriosis can be a really difficult condition to manage, but with the right support, it is possible to live a full and a healthy life. So if you suspect you may be having endometriosis, don't hesitate to call on this number and talk to our homeopathic specialist for a painless, natural recovery with our non-hormonal medicines. Before we end, let's see other illnesses that can mimic endometriosis, like ovarian cyst. Now, ovarian cysts are fluid-filled sacs that can develop in the ovaries. They can cause very similar symptoms to endometriosis, such as pelvic pain and heavy periods. They can be diagnosed through pelvic examination, ultrasonography or MRI. Then we have pelvic inflammatory disease, also commonly called as PID. They are the infections of the female reproductive organs, such as uterus, fallopian tubes and ovaries. It can also cause very similar symptoms to endometriosis, like pelvic pain and very heavy periods. It can be diagnosed through pelvic examination, laboratory test and other imaging studies. Then there is interstitial cystitis. That is a chronic condition that causes pain and discomfort in the bladder and pelvic area. It can also cause similar symptoms to endometriosis. That can be pain, heavy periods, but it can be diagnosed through a combination of medical history, physical examination by a specialist, and other diagnostic tests. And lastly, adenomyosis. Adenomyosis is a condition where the endometrial tissue grows into the muscle wall of the uterus. It can cause similar symptoms to endometriosis, very similar pain and very heavy periods. And also it can lead to infertility. It can be diagnosed through pelvic examination, ultrasonography and MRI. So the best way to diagnose endometriosis is through a laparoscopy, which is a surgical procedure that allows the specialist to look inside the pelvic cavity with a small camera. Now the other diagnostic tools like ultrasound, MRI and blood test may also use to support the diagnosis. It's important to work with a specialist to figure out the underlying cause of the symptoms and also to rule out any other health problems that may be mimicking the endometriosis. So if you are concerned about endometriosis or the infertility due to endometriosis, talk to a specialist for our homeopathy assisted reproduction therapy. Remember, you are just phone call away from pain relief from endometriosis and getting back on track. That's all in today's episode of Dr. Welling's Health Show. Bye and take care.